So one of the things we like to cover in neurology today, as you may have noticed, is technology in neurology. And with us to discuss neurotechnology, we have we have Neil Mehta, who is at Arizona State University and is working with a decision support tool for epilepsy that he's going to talk to us about. At the annual meeting this year, he has an abstract, his group has an abstract about this technology, and we'd like to hear what were the main findings of the use of this decision support tool in epilepsy patients.
Yes, so the tool was used at Mayo Clinic, and with a randomized clinical study, the findings were that it was 86.4% sensitivity and 87.1% specificity. What it means that it was able to better screen individuals who have epilepsy at the epilepsy monitoring unit at Mayo Clinic. So what it identified is how you can screen patients who have epilepsy, and also helping neurologists so that they can better triage patients who come to the clinic.
So is this an app-based technology?
Yes, it's an app-based technology. The data stays on the HIPAA-compliant cloud server. It's a software tool available on any smart devices where you can input patients' clinical signs and symptoms along with their physiological symptoms, and also if they have EEG results. So that what it does is that it basically takes all that information and it maps to our gold standard and our artificial intelligence algorithm on the back end, which are also clinical and evidence-based, and then it speeds the epilepsy differential diagnosis. So it helps healthcare professionals and neurologists to identify what type of epilepsy is trending in that patient, moving towards personalized medicine.
I see. Can it also help a neurologist potentially differentiate between seizures and pseudo-seizures, or is it more meant to help determine what type of epilepsy the patient has?
So first of all, it identifies whether they have epilepsy or not. And yes, to answer your question, it also helps physicians to identify whether the patient has an actual seizure or an epilepsy syndrome, and compared to the psychogenic or the pseudo-seizures.
I see. So a physician uses the tool as opposed to the patient?
Yes, so the study at Mayo Clinic was focused towards physicians, and now we are also launching what we call all the things what is going on with them before they see their specialist, so that by the time they see them at the clinic or the hospital, the physician or the neurologist have ease of use and a peace of mind, so that they can have a human-to-human conversation and they have all the information from the patient. But the ultimate decision or the diagnosis lies in the hands of the physician. So we just provide them with the guided tool, and they take the ownership of that patient and provide the medication and the treatments after that.
Sure. So we're hearing a lot about decision support tools being used in medicine in general, and I think it's going to be a leap forward to really help doctors make accurate diagnoses. The question I have, though, is there any way for electronic health systems, for example, to automatically enter information into decision support tools like EpiFinder? Is that something that you have now or something you're looking at for the future, or does the doctor have to enter the information in manually? How does that work?
So to prove a proof of concept, it's a manual input of patient information on our app, but we are working with leading EMR companies like Epic and Cerner to do the API integration, so that it's a plug-in and play. So whatever systems you are using, the physicians or the neurologists will be able to use that. And also what we are doing on the top of it is that if you want to just focus on the patients who have been to your practice in the last 6 months or the last 12 months, we collect that information and auto-populate into our system, so that now you just have to find the patient name. Also, we have a voice to text, so if you say, okay, I want to find the records for patient A, it will pop up. You will see the last date of visit. You will see when they showed up, and you will also be able to see the last 4 to 5 patient visit of the type of the epilepsies they had. So you not only you are able to do the prospective screening, but you are also able to use this tool as a education or the data analytics platform.
That's really great. So I think it's clear that apps will never replace us, but apps can certainly help us. And I think decision support tools are really important, especially as we move into the era of evidence-based medicine. So I thank you so much for coming in today, and that was very helpful. Thank you.
Thank you.